I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. It's American Heart Month, a time to empower and educate people about heart disease, the #1 killer of both men and women. With that information, there are many positive steps to help improve heart health and decrease your risk for heart disease. In this episode, we're talking with a team of experts from ThedaCare Cardiovascular Care. Joining us first is Dr. Amir Kapoor, a cardiologist and Senior Medical Director of ThedaCare Cardiovascular Care. Dr. Kapoor, thanks for being with us.
Thank you very much for the invitation.
So we're going to play a little game today to kind of get us into heart health in our conversations. This is myth versus fact. So I'm going to ask you a series of statements and mention those, and then you're going to tell us if they are myth or a fact.
Sure, absolutely.
All right, the very first one here. Heart disease is more of a concern for men than women. Is that myth or fact?
It's a myth, and there is a reason for that. It used to be in the past, when we didn't have that much of knowledge about women heart disease, that men are more commonly coming to the visits and heart attack and all of that stuff. So we made that statement. But currently, really, there is no difference. Both could have heart problems, similar in every fashion and statement. Actually, it's more difficult to deal with the woman's heart disease because their symptoms is very atypical. One time I had a patient who had a heart attack and she was having some dental ache, and that's it. And then we figured out too late that she had a heart attack. If you have a very unusual symptoms, some kind of problem, please go to the hospital, go to the emergency room, go to your doctor, talk to them, and get the right diagnosis before it's too late.
Good to know. All right, our next one here. If heart disease runs in your family, you can still take steps to reduce your risk.
Absolutely, it's a fact. And the reason for that, every one of us has to be intelligent. I call it to be smart regarding taking care of yourself. If you have a family history, it's a strong risk factors for having blockages in the arteries, having a high blood pressure, having a high cholesterol. Go to your doctor on a regular basis and let your family doctor assess you and evaluate you and treat you. At the same time, lose weight. Take care of your cholesterol. It's very important to have it checked on a regular basis, at least annually. You cannot change your gene. That's what you need to remember. So for that reason, taking care of these steps and modify your lifestyle to improve your quality of life, that's very important.
Okay. Our next one. It's mainly older people who should be concerned about their heart health.
That's a myth. And the reason for that, it's younger and older. Actually, these days, we see the younger people having more heart problem because we are more aggressive in diagnosing their heart problem. The youngest heart attack patient I had, 29 years old. So that's a reminder for everyone.
Wow. Okay, good for us to remember that. All right, if you have heart disease, you should avoid exercise.
Oh, that's a myth. I mean, you absolutely not. Actually, we encourage exercise. We want the people to exercise when they have a heart problem because that's a way to improve their quality of life and get their heart back to normal.
Okay. Even if you eat well and you're fit, you should remain vigilant about your heart health.
Absolutely. It's a fact. No matter what you do, you should pay attention to your heart and be vigilant, and you have to take care of yourself no matter how good you are.
That's, again, really important things for us to keep in mind.
Absolutely.
Okay, so thanks for talking us through all of that. Later in the program, we're going to talk more about prevention and steps that you can take. I do want to talk to you about a few other questions that we have when it comes to heart health.
Sure.
Can you just tell us again kind of why routine care is so important when it comes to your heart?
The routine care is going to do some extra diagnostic step to allow the physician to have an idea about the risk of that individual to have a heart problem in the future. So he is the one who ordered blood tests for the patient and come up with the cholesterol and blood sugar and can detect if these patients can get or require treatment, specifically medication, exercise, diet. That's by itself will reduce your chance of having heart problem by about 40%. 40%, that's a huge number. The second step, they do some testing like, for example, an EKG. Don't question why they are doing it. because some of the changes which we see it in the EKG, it could be the early sign for having major heart problem. Believe it or not, most of the heart attack or blockages, we discover it at the first site when we do basically the EKG for those patients.
Oh, that's all good information. We also know that ThedaCare is here when it comes to comprehensive cardio care services. Can you talk about the care options that are offered here?
Oh, absolutely. We offer all of the diagnostic testing possible needed for heart patients. We do every single procedure you can imagine. We do structural heart. Like some of the patients, we don't send them to open heart surgery for valve replacement. We do it percutaneously through the groin. We call it TAVR or mitral clip. We do all of the imaging possible for the patients, from MRI to CT scan to the regular stress test and the simple stuff, which is including the EKG, and see a cardiologist.
Perfect. Dr. Kapoor, thanks so much for being with us and explaining all of this.
It's my pleasure. Thank you.
2024 marks the 20th anniversary of Go Red for Women, an American Heart Association initiative that empowers women to take charge of their heart health. The CDC states that more than 60 million women in the United States are living with some form of heart disease. That's nearly 44% of all women. Joining us to discuss women's heart health is Dr. Salviar Mak, a cardiothoracic surgeon with ThedaCare Cardiovascular Care. Dr. Mak, thanks for joining us.
Thank you, Cass. Thanks for having me.
So I want to start out really with our first question, wanting to know about women and throughout their lives, their risk for heart disease and heart issues kind of changes. Can you walk us through some of those big time periods in a woman's life
Sure.
when they might have, experience and changes?
Sure. The number one is the age of menarche. That means age when a woman or a girl starts going through puberty and start having periods. Menarche before age of 10 or after 17 years of age will increase cardiovascular risk later in life. And secondly is the use of contraception because of the estrogen level, that will also somewhat increase cardiovascular risk. Then we get into pregnancy as well as postpartum. About 30% of women will go through some sort of cardiovascular symptoms because of adverse pregnancy outcomes. Those are gestational diabetes, preeclampsia, eclampsia, high blood pressure during pregnancy, and even having no children or more than 5 children will increase our risk later in life as well. One good thing about having children is lactation or breastfeeding. The studies have told us that breastfeeding will have long-term cardiovascular protection in life. So it's not just good for the babies, it's good for the mothers as well. The longer a mother breastfeeds, the longer the effects will be. And then afterwards, as we go through life, at some point we'll go through menopause or transition into menopause. During that time, there's a lot of emotional changes, bleeding habits changes, and psychosocial changes, and also that's a lot of changes in our body as well because of the hormone changes. So during this time, studies have told us that there will be increase in cardiovascular risk because of increased lipoprotein profile. Our arteries will tend to be stiffer, which lead to high blood pressure. But there's still a lot of things we can do to help ourselves.
Mm-hmm. And like you said, it's changes throughout a woman's life. Mm-hmm. So we just have to be aware of those times.
Exactly.
All right, Dr. Mak, thanks for being with us.
Yeah, you're welcome.
Next, we want to offer ways to safeguard your heart health, as well as emergency steps you can take if you witness someone having a heart attack. Amanda Cottrell is our clinical program specialist with ThedaCare Cardiovascular Care. Amanda, thanks for being with us.
Thanks for having me.
So today we're going to start with prevention first. We're going to talk through Life's Essential 8. This is a tool from the American Heart Association that talks about some key factors and behaviors that will impact heart health. So we're going to go through our spinner here, and then you are going to help explain that behavior.
All right, sounds good.
All right, let's take a look at our first one here on the wheel. We have be more active.
Be more active. We want to make sure that we're staying physically active. It helps keep our blood pressure low. Overall, general health is much better if we're physically active.
Okay, and I'm sure it helps with maintaining healthy weights too.
Oh, yes, definitely.
Absolutely. Okay, let's look at number 2 here on our wheel. It is eat better.
We want to make sure that we're eating a healthy diet that consists of fruits, vegetables, fiber, fats, proteins. Eating a low sodium diet is also good for your heart. It's also going to help maintain your weight if we're eating the right things.
All right, let's take a look at our next spin. It is control cholesterol. How does this one tie to heart health?
So cholesterol is one of the key factors in blockages in the heart. So we can follow that with our primary care physician in our annual exams, along with blood sugar and blood pressure. Knowing your numbers is also good. So you want your HDL to be higher, which is the good cholesterol, and your LDL to be less than 100.
All right, our next one on the spinning wheel. It is, quit tobacco.
Tobacco actually can help cause blockages, causes constriction of the blood vessels, which can in turn increase blood pressure, all of those sorts of things. So definitely quitting smoking, all tobacco products is important.
All right, our next one is get healthy sleep.
A good 8 hours of sleep will help that body reset and kind of refresh and renew for the morning, so the next day.
Okay.
We heal overnight.
These are all good things for us to keep in mind. Thanks for explaining this for us.
Thank you.
Now let's talk about emergency situations. It might be frightening to imagine someone around you experiencing a heart attack or some kind of heart situation, but there are some simple steps that we can take as a bystander to help that person. So we are going to ask first for you to walk us through these steps and explain what the process is.
Sounds good. When you come across somebody that's laying down and is unresponsive, you're going to want to try to get their attention. Make sure that, we can't just wake them up. They're not just sleeping. Sure. So we're going to be like, Annie, are you okay? You're going to tap them, physical touch to try to wake them up. If they're non-responsive, we're going to if I have somebody else there, I'm going to send them to call 911 and get an AED. Okay. I'm going to then start hands-only CPR. So to start hands-only CPR, we're going to put our hands in the center of the chest, and we're going to press up and down firmly at the rate of about 120 beats per minute. And we're going to continue that until help arrives.
Okay, so 120 beats a minute. I've also heard people reference like songs that you can kind of do to keep the rhythm in your head. What are some of those songs that we could use?
So you can use Staying Alive. For kids, Baby Shark.
Okay.
That's another one. It's one of those songs that gets stuck in your head.
Yes, it does. So, and you just do that to the beat?
Yes.
Okay. And then, what is it doing for that person who is experiencing this kind of heart attack or heart situation?
So we're providing blood flow to the body and the brain by compressing the heart. We're perfusing blood to the rest of the body. With every recoil is when air gets pulled back into the lungs, and that's where we used to do breaths. We don't have to anymore. That's where your oxygen gets back into the lungs.
It seems scary. When you think of it like this, and when you're in that situation, it seems overwhelming. What advice do you have for people, in that moment?
I think one of the biggest things is to stay calm. Know your surroundings. So if you can get somebody to go for help, that's the quickest thing. If you have a phone on you and you need to call 911, put it on speakerphone, set it next to you, and start your chest compressions. That's probably the easiest way if you're the only one.
And this can save a person's life.
It can. Something is better than nothing, even if you're not confident and you're doing it correctly. Doing something, some sort of compression on the chest is better than doing nothing. You could very well save your loved one or a friend, a stranger. You could save somebody's life. So,
all right. I'm so glad you walked us through this. This is great.
Thanks for having me.
And remember, you have the power to influence your heart health. Following healthy habits and keeping up with routine care are great places to begin. You can visit My ThedaCare to schedule your annual wellness visit today. Thanks for watching.
At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.